So today I'm going to walk you through a non-surgical rhinoplasty, which is an amazing way to use injectable fillers to help straighten the nasal bridge, fix dorsal humps, fix bumps after a broken nose, and even lift a nasal tip. Let me pause here because there is clearly a lot going on. So the silver measuring object is a golden mean caliper. I use it to measure the golden ratio, also called the divine proportion, and it's a guide to where I place filler and how much I use. Now the golden ratio is known as the most proportionate facial ratio. It's historically used in arts and histories as the most attractive to the eye, and also some of the world's most attractive celebrities have this facial ratio. And I try and achieve this ratio as close to I can on my clients with the measurements beforehand. Oh, and this golden tool over here is a vibrating tool. It vibrates into the face and it diminishes the amount of discomfort. It's a great form of anesthesia and I use it for almost every injectable procedure. Probably wondering what all those white lines are. So after measuring the correct angles with the golden calipers, I mark the proportions, and I always mark before I inject so I can use this as a guide to where I'm injecting. It's so important to do that because as you progress with any injectable procedure, your skin can and will swell. After careful measurement and markings, I'll start the injections. I always discuss beforehand which type of filler to use. I base this on discussing the patient's needs as well as observing the anatomy I'm working with. Well, don't I look focused and intense here? You'll see me frequently taking a step back and looking at the placement. So I'll inject and stop, check my work, and I do this to check to see the placement of filler and if the results are progressing the way I like. It's really important for me to be specific and exact. The nose is a highly vascular area. Some of these blood vessels can go directly into the blood vessels of the eyes and the brain. I cannot stress enough, you have to go to an experienced injector, someone who's very familiar with the anatomy in the nose. If done incorrectly, you could risk blindness. It is rare, but it can happen. Here I'm close to the final results, so I look for any last minute final touches. I look at the smoothness, symmetry, and the shape of the nasal bridge. I look at the nasal tip. I make sure that the nasal tip suits the new nasal bridge shape. You can actually lift the nasal tip. In this patient, we decided not to do that so he could have a more masculine nose. And when I'm satisfied and I realize we've achieved the shape we want, it's important to know when to stop. This is because the skin and the tissue can swell and distort the shape, and it's also why marking and measuring the skin before is so important. You see that smile right there? Well, believe it or not, this is a very comfortable, very well tolerated procedure with excellent immediate results.